Hello, and welcome to Retire Safe's conversation on surprise billing. Through this video, we hope that you gain a better understanding of what surprise billing is, who it impacts, the major stakeholders involved, current pieces of legislation, and how you can get involved in the debate. What is surprise billing? Surprise billing occurs when an insured patient unknowingly receives care from an out-of-network provider and receives an expensive and unexpected medical bill. There are two components of surprise billing, the first of which is higher cost-sharing requirements. Under your health plan, you may be required to pay certain percentages of allowed charges for in-network and out-of-network services. This means that a high surprise bill could result in you paying a higher amount than normal under cost-sharing requirements. The second component of surprise billing is balance billing. This occurs when an insurer's rate does not cover the provider's full rate, and the out-of-network provider can bill the patient for the difference between the allowed charge and the full charge. This can occur unless prohibited by state law. In-network providers are not allowed to balance bill patients.
When can surprise billing occur? Surprise billing can occur in emergency room situations as well as in planned care situations. In 2017, 18% of all emergency visits and 16% of in-network hospital stays had at least one out-of-network charge. Regarding the public's feelings towards surprise billing, 38% of Americans are very worried, and 29% of Americans are somewhat worried about not being able to afford their own or a family member's unexpected medical bills. 78% of Americans support passage of federal legislation to protect patients against surprise billing. 57% of Americans support surprise billing legislation even after learning that doctors and hospitals could be paid less.
Before we explain the different pieces of legislation regarding protections against surprise billing, it is important to understand a few terms. The first of which is the Independent Dispute Resolution Process, also known as the IDR process. The IDR process is when the third party accepts offers from both providers and insurers and then chooses the most appropriate amount to be paid. Another term to know is the Employment Retirement Income Security Act of 1974. The ERISA. This act allows individual states to regulate group health insurance policies that some employers purchase from insurance companies. However, 61% of covered workers are covered under self-insured group health plans, which are not subject to state regulation. Throughout the presentation, the term providers will be used to represent physicians and other medical personnel, and the term insurers will be used to describe insurance companies. Apart from paying high in-network prices, the Brookings Institute found that insurance plans pay out-of-network providers' charges in full about 25% of the time. Although patients are not fitting the bill every time, this practice is costly for insurers. These costs are not only passed down to the patients who receive a surprise bill, but to everyone enrolled in a commercial insurance plan through higher premiums.
All of the committee bills discussed apply surprise billing protections to out-of-network emergency services and post-stabilization inpatient services. All of the committee bills also apply protections to services provided at in-network hospitals and facilities by out-of-network providers. In all of the committee bills, patients are held harmless. This means that insurers are required to cover out-of-network claims and apply in-network level of cost sharing for surprise medical bills. Additionally, providers cannot collect any more than the in-network cost sharing amount from patients for the surprise bill in question. Now we will go over how the different bills approach payment resolution. The House Energy and Commerce Committee bill includes a default payment rate equal to the insurer's median in-network rate based on the 2021 rate, which will be indexed by inflation using the Consumer Price Index, CPI-U. The independent dispute resolution process will be available to insurers and providers if the surprise bill in question is greater than $1,250 and either party is dissatisfied with payment at the median in-network rate. The Congressional Budget Office estimates that this bill would lead to $21.9 billion in savings over 10 years.
The Senate Health, Education, Labor, and Pension Committee bill includes a default payment rate equal to the insurer's median in-network rate for the same service in the same geographic area. The bill also provides surprise billing protection for air ambulance charges. The Congressional Budget Office estimates that this bill would lead to $24.9 billion in savings over 10 years. As of December 2019, the Senate Help Committee and the House Energy and Commerce Committee have come to a compromise by determining payment based on the median in-network rate, with independent dispute resolution as an option if either party is dissatisfied and the bill in question is greater than $750. In this compromise, surprise billing protection for air ambulances remains. The House Education and Labor Committee, which possesses primary jurisdiction over ERISA-governed group health plans, released a bill that closely resembles the compromise laid out by the Senate Help Committee and the House Energy and Commerce Committee. The bill includes a default payment rate equal to the insurer's median in-network rate based on the 2019 rate and indexed for inflation annually. The bill includes specific protections against surprise billing charges for air ambulances. In contrast to the other committee bills, this one gives the Secretary of Health and Human Services the authority to apply surprise billing protections to ground ambulance services after receiving recommendations from an advisory committee of stakeholders and experts. The Congressional Budget Office estimates that this bill would lead to $23.9 billion in savings over 10 years.
The House Ways and Means Committee bill does not include a default payment rate for initial payment of the claim. Instead, this bill requires that negotiations between providers and insurers take place for each surprise bill. The independent dispute resolution process is available for both parties if these negotiations are unsuccessful regardless of a claim threshold, meaning that the surprise bill does not have to reach a certain dollar amount for the IDR process to be implemented. The Congressional Budget Office estimates that this bill would lead to $17.8 billion in savings over 10 years. Of the committee bills, the American Hospital Association supports this bill because it does not include a default payment rate, but instead gives providers and insurers the freedom to negotiate payment. Regarding surprise billing legislation, the American Hospital Association stated, once the patient is protected, providers and insurers should be permitted to negotiate payment rates for services provided. We strongly oppose approaches that would impose arbitrary rates on providers, as it would compromise patient access to care and create disincentive for insurers to maintain adequate provider networks, particularly in rural America.
Sponsored by Representative Ruiz of California and Representative Rowe of Tennessee, the Rowe-Ruiz bill takes an altogether different approach from the previous committee bills discussed and is not sponsored by a committee, meaning it does not cover the same scope of surprise billing protections discussed at the beginning of the presentation. The bill does not include a default payment rate for the initial payment of the claim, but requires negotiations between providers and insurers for each surprise bill. If neither party can come to an agreement, providers and insurers would engage in the IDR process. In this case of this bill, the IDR process would consider both the median in-network payment rate and the 80th percentile of actual bill charges. No formal Congressional Budget Office estimate has been published yet, but an article in The Hill claimed that this bill could cost double-digit billions over 10 years. This bill is supported by the doctors and physician-sponsored lobbying groups because through the IDR process, it allows a third-party arbitrator to consider the amount that doctors charge before ever negotiating with insurers. This amount is much higher than the negotiated amount between providers and insurers, and using it determines payment resolution could drive up cost and lead to increased payment to doctors.
Health insurers and employers recommend a federal payment standard such as the median in-network payment rate because it is less complex and less costly than using the IDR process as the sole method of payment resolution. Hospitals and physician groups are opposed to using a default payment system like the median in-network payment rate because they are concerned that a default payment system encourages insurers to rely solely on the default payment system rather than enter into contracts with providers to join networks. Additionally, hospitals and physician groups fear that the default payment system could lead to broader federal rate setting for provider payments in the future. Overall, hospitals and physician groups support the payment resolution method of negotiation and mediation.
Now that you have a better understanding of what surprise billing is, who it affects, and the different bills addressing it, Retire Safe encourages you to get involved. First, read the relevant materials. At the end of this presentation, there are numerous links listed on the sources slide that provide in-depth analysis of each bill, as well as articles that detail legislative updates regarding the bills. Second, contact your senator or representative about the bill that you support and ask them to get involved in the surprise billing debate on your behalf. The links to find your senator or representative's contact information are listed on the current slide. Third, continue to follow the updates on surprise billing legislation to stay informed and ensure that no patient has to suffer through the struggles of surprise billing ever again. If you have any questions regarding surprise billing, please email contact@retiresafe.org. Also, be sure to follow us on both Facebook and Twitter to receive updates about surprise billing and other issues that we at Retire Safe are following to make sure that your voices are being heard. Thank you for watching and have a great day.